الثانية أو الأسبوع الثاني اتكلمنا عن الدايت، والأسبوع اللي فات اتكلمنا عن الحالات الإمرجنسي وإزاي نتصرف فيها. إحنا النهاردة الأسبوع الرابع هنتكلم عن العلاج الطبيعي. معانا ماريو هيكلمنا عن الموضوع ده، وماريو هيبقى يدينا بقى ايه المحاضرة، يعني ميكس كده as you like يا ماريو، عربي وانجليزي ميكس زي ما انت عايز. لو مش قادرين نفهم هنقول لك، يعني ما تقلقش. فجو اهيد لو سمحت، اتفضل. تحب اشير اي حاجه؟
I'll share my screen if that's okay.
It's okay.
يا جماعة بس أنا عايز أقول لكم ماريو رائد وديع. هو أخصائي علاج طبيعي ومعاه ماستر من ماكماستر، ويبقى طبعا ابن رائد، أخونا رائد الخادم. وطبعا يعني أنا بعرف ماريو من زمان، ثانك يو ماريو إن أنت معانا النهاردة، ومبسوطين إن أنت معانا. إن شاء الله ما تبقاش آخر مرة يعني.
Thank you uncle. Hopefully it's beneficial. بس انتوا كده سامعيني ولا اعلي صوتي اكتر؟
كده كويس جدا.
Okay, تمام. I will share my screen now. Okay, how should we care for our seniors? I'm going to start off by just telling you what we're going to talk about here in a second. Here are some of the topics that we're going to cover today. One is pressure sores. These are basically open wounds or wounds that open up because of high pressure areas in the body. Because in older adults they have thinner skin and it's just weaker and less cushioned. The second thing we're going to talk about is blood clots and just how to quickly look for any signs of them and when people might be at risk for blood clots. The third thing is risks for falls, because older adults are at a higher risk for falls, so we need to watch out for that and how to prevent it. And then weakened bones and muscles, which is common, again, not even just in older adults, but even after age of 30 and 40. And then conditions that might require a little more assistance. So if someone's had a stroke or a spinal cord injury. Okay, so the first thing we talk about is pressure sores. Like I told you, it's a deep open wound, and it develops in areas that hold a lot of pressure or where people tend to put a lot of pressure. So some of the common areas are if you have people that, when they lie down in bed, the back of the ankle, because it's a very common bony area, there's a lot of pressure going through that area, and because of the pressure of the bone through the skin on the tissue, that can cause a pressure sore there. Another area that's very common is the back of the head, the prominent area on the back of the head, and then the tailbone. These are three very common areas. And there are some things that make you more susceptible to it, like risk factors. So first one is the most common one. It's when people don't move a lot. So if people are all hanging out and they're kind of lazy to move or too tired, or this is very common, اللي هو حبيبي هات لي البتاع اللي هناك دي. That basically encourages people to be lazier or move less, which again, if you're not moving for a very long period of time and there's lots of pressure through these areas, that's going to put you at risk for a pressure sore. People with diabetes, because of the poorer circulation, they have less healthy skin and weaker skin, so it's more susceptible to breakdown. And then conditions that have paralysis or associated inability to move, like spinal cord injuries or strokes, or cerebral palsy, any of those things, they can cause you to not be able to move. And if you can't move and reposition, whether it's in bed or to get up every once in a while and walk or something, again, you're more susceptible to it. So what can we do about it? Very simply, encourage people to be more active. So don't sit in the same chair for more than 30 minutes or so. Get up and go for a walk or something along those lines. And then you can place supportive pillows underneath areas that are commonly affected, just for additional cushioning. So maybe behind the tailbone, maybe underneath the foot, maybe behind the head, depending on what the person's doing and where they're sitting. So basically, just encourage them to be to move more rather than less. Okay, the next thing we're going to cover is blood.
ماريو
Yes.
عايز اسالك بعد اذنك البيلو هنا بتساعد في ايه؟
البيلو علشان like if you're lying down on like a harder surface, or if your foot is on a harder surface like the floor, for example, the back of the ankle, انت عندك كده two hard surfaces, the bone and the floor at the same time.
لا ده انا حتى يعني الناس انا فاكر مثلا الناس الكبار اللي بيبقوا قاعدين على السرير بيقولوا حطوا بيلو.
Sometimes the mattress also becomes a little
hard.
Yeah, hard, and because of the friction also between the surfaces, if they're moving a lot وكده, that can do it. So if you have a pillow there, it's less likely to happen.
Okay.
But that's the bigger point, or the more important point, is just to encourage them to reposition. So even if someone's laying down for to sleep or whatever, or laying down on a couch or something, at least يتقلبوا يعني every 20-30 minutes, just to put pressure on a different area of their body. That's all. Any other questions? Okay. The next thing we're going to talk about is blood clots. So basically, there are a couple of easy ways to identify if someone might be having a blood clot. It's not 100% accurate, but here are some quick signs to look for. If you're looking at someone's left side and right side, for example, in their arms or legs or calves, if they have severe swelling, or an obvious change in skin color, or if it looks different, the skin looks significantly different from side to side, if there's redness, if there's severe warmness, and severe pain in the area that's not necessarily associated with movement, those can be some indicators of blood clots. And the most common area is the calf, but it can happen in the thigh and arm as well. Older adults are at risk for this because they have poorer circulation. Some of them have varicose veins. If you know what those are, it's like when someone looks like they have very superficial and spidery kind of veins. And then the other thing is, again, if they don't move very much, because the veins in our body already, veins, they don't generally propel blood very well in older adults because of the decreased muscle mass, and because those blood vessels are less strong. It's not able to push blood as efficiently. So again, a lack of movement will encourage that as well.
الفاريكوز فين اللي تقصد بيها دوالي مش كده؟
Don't know what that
دوالي
is.
رجلين.
Yes, بتحصل في الرجلين usually. And again, if someone has a blood clotting disorder or something like that, they may be at a higher risk for blood clots as well. If someone's had a surgery and they haven't been moving a lot after their surgery, or in the first 2 or 3 days or so, they are also more susceptible to blood clots. So that's something to watch out for if you know anyone who's had surgery, even if they've had fractures and they've been in a cast for a long time or something like that. That can also make them more susceptible to it. So basically, you're in another scenario where you want to encourage people to move and not be sedentary. And there's a few exercises that you can try to get them to be active every hour or so, just to help keep the blood flow moving. But if you do suspect that there is a blood clot, you need to get the person to the emergency room. I'm one person who errs on the side of caution. In clinic, when I'm working, I've sent 3 people to the emergency room. Only one of them had a blood clot, but I'm okay with that because I would rather them be alive. than worry about making a mistake. Anyways, here are some of the exercises that you can try. So the first one is called ankle pumps. Basically, you're getting the person to point their toes and pull them back towards their head, as you can see here. I like to tell people, pretend you're hitting the gas pedal in the car and then taking your foot off the gas pedal. Whatever works for you, you can describe it to the person who's doing it. That's for the ankles. And then another thing you can do is for the shoulders, basically just moving the arms up and down. With these exercises, you're not pushing through any pain or stiffness. You're just pushing them through whatever the range of motion they have that's available to them. And again, you're just going to repeat these exercises every hour or so. The third thing is neck circles. Just be careful with this one to go nice and slow and controlled so that people don't get dizzy. Circulation is not as good, like we mentioned earlier, in older adults. You don't want them to get dizzy or lightheaded. You don't want them to fall off their chair for sure. So that's for the neck. Elbow straight forward. You're just going to bend and straighten your elbow out. And I think that is all of them. So you're going to repeat this every hour, or encourage them to repeat it every hour. You can do 2 sets of 10 repetitions, or you can do 30 repetitions, whatever they're comfortable doing. Make sure it's just nice and controlled, and they're not just rushing through the exercise for the sake of rushing through the exercise. Again, this helps with circulation. We're not trying to increase the range of motion or anything like that. It's a whole different topic. But basically, that's one of the ways you can help keep the circulation moving to reduce the likelihood of them having a blood clot. So like I said, people who have had surgeries are probably at the most risk, or people who have not been mobile for very much, or if they've been in bed for more than 3 days or so, where they're not really moving very much. The next topic we're going to talk about is the risk of falls. Older adults are at a risk of falls because they just have poorer balance. And balance has 3 main contributors. You have strength, you have reflexes, and you have vision. And unfortunately, all 3 of those things deteriorate with age. So strength actually drops as much as 40% between the age of 30 and 80 years old, which is why we always encourage people to do some form of strength training or resistance exercise or anything along those lines, whether you're an adult or older adult. It's very important to do because it prevents or helps slow down that strength loss. The other thing is reflexes and reaction time. And you can see that also with just even things like driving on a day-to-day basis. If you have an older adult, they're not going to react as quickly as a young individual. And so, for example, if someone is walking, if you have an older adult who's walking and they trip over something, they're less likely to be able to react and move their feet or arms in a position to help brace themselves or stop their fall or control their fall as compared to someone who's younger. And then the other thing is vision, which again, vision is not as good when you're older. So if you can't see very well, you're more likely to trip over objects. The other thing is you want to make sure, because their circulation is not as good, they're more likely when they get up to be lightheaded a little bit. So make sure when they're getting up from a seated position or sitting to standing, or to get up for a walk or so, or even lying to standing, whatever the case, you want to make sure that they're doing it nice and slow, and if they feel lightheaded, pause before you start moving, because that will reduce the risk of falling. So how do we actually address this? There's a few different things you can do. One is you can do strength training. So there's a few different exercises here. They're just very basic exercises you can try with your seniors. The first one here is basically you're standing, arms are on, or hands are on a chair just for balance. That's the one here on the right. And you're basically just swinging your leg out to the side and bringing it back in, moving from the hip. Nice and slow and controlled, because if you do this movement too quickly, you're not really getting the benefit of getting the muscles working. The second exercise you can see here is just for the calves. So you can do this while you're sitting. Basically, your feet are on the ground. You're lifting your heels off the ground and putting them back down. Lift them up, put them back down. When that gets too easy, you can move it to something like the second picture where they're doing it again against the chair and standing. And if they're feeling very adventurous and safe and balanced, you can give them a weight or two and have them do it without a chair or even without weights. The last exercise here on the bottom is it's like a squat, but you're really using a chair and just going from a sitting to standing position. Encourage the people, if they can, to do it without using their hands, because that will really challenge the strength of their legs. These are some basic exercises that are basically going to strengthen the lower body or some of the muscles of the lower body, which are, again, going to help you if it comes to if they're in that scenario where they're about to fall and they decide to brace themselves, even if it's a little late, if they're stronger, they're more likely to brace themselves. The second thing is, again, keep them moving, because in physio we have a saying called use it or lose it. The less you use your muscles, the weaker they get. Same thing with any other part of your body. And then again, encourage them to just slow down if they're feeling lightheaded or have any of those signs. You can also play games with them, encourage them to challenge their balance with games like if they wanted to stand with their feet closer together and throw things to each other like a small ball, or if they're feeling good, maybe even on one leg. Just make sure that they have someone next to them to support them if they need it, because you don't want them to fall. I would probably do those things with one person standing quite close to them just to make sure they don't fall. But make it fun so that they're not bored while they're doing it. That's most people's excuse for not doing exercises. It just gets boring. You can make it a competition. You can do something along those lines. The other thing you can do to make sure they don't fall or to reduce the risk is to make sure the environment is tidy. The less clutter that is around on the floor or anything like that, the less likely they are to trip over things, which puts them at a lower risk for falling. Those are the main ways you're going to help reduce the risk of falling. And now we're going to talk about bone strength. Bones, again, get weaker with age. The density of the bone or the actual.
عايز اقول حاجه بعد اذنك يا ماريو.
Sure.
ان الفول كمان بيحصل اكتر مع الناس الكبار في السن نتيجه للادويه اللي بياخدوها.
Yes.
بياخدوا ادويه كتير. A lot of medication بتعمل dizziness وبتعمل drowsiness، وبياخدوا كمان كتير ادويه بتبقى central nervous system depression، يعني كمان sleeping pill وكده، ودول بيخلوهم بيقعوا بسهولة قوي.
This is true. That's a good point. So again, that's something important to keep in mind. Thank you, Uncle. Okay. Bone strength, again, so the density of the bone or the bony substance within the bone decreases with age, which makes people more likely to get a fracture. So if you go back to the previous slides, we talked about risk of falls. If they're falling, they're more likely to get a fracture than someone younger, even if it's a very gentle fall, because they have the weaker bones. Bone density decreases with age, and then fractures at that age or at an older age are more dangerous, especially if they're at the thigh area, because of the big blood vessels in the area. If you have a fracture there and one of those blood vessels gets punctured or anything along those lines, it's more likely to have a very, very severe outcome, and it can be fatal. So you want to make sure to avoid that for sure. And even if they don't actually fall, if they have conditions that make them more susceptible to those fractures, like osteoporosis, which basically just means an accelerated weakening of the bones, more than what normally happens with age. Even if they were to trip and kind of brace themselves on a wall or something, they might still fracture their wrist or something along those lines. And then again, bones are also weaker at that age because older adults will tend to eat less or less nutritious foods because they have a decreased appetite as a result of basically their taste buds aren't working as well as younger people, so they don't crave food as much. So sometimes they just forget to eat, which is very common. And if they're not eating, they're not getting the nutrients they need to keep the bones nice and strong and healthy. So you want to recognize those things which make them more susceptible to fractures. So what can we do about it? One, again, strength training. Strength training actually causes people to your bones to strengthen actually, and reduces that reduction in bone mineral density or bone density with age, which basically slows down the deterioration of bones, which is good, which you want, so that when they do fall, if they do fall, they don't get those fractures. Two is encourage them to eat, even if they're not necessarily hungry. If you notice someone's not eating or hasn't eaten all day or something along those lines, make sure they're getting some sort of nutrition. And perhaps make sure, if that's something ongoing for them, that they're seeing their or talking to their doctor or someone who's an expert in the field with diets or nutrition, just to make sure that they get enough nutrients to help with prevention, and if they do have a fracture or anything along those lines, that'll help it heal quicker. The other thing is, I think there are also, yeah, I can correct me if I'm wrong, but I think there are also medications that do make bone mineral density less. So that might also be a factor that plays a role. You're not really going to change their medication, but if that's a factor, then they need to definitely be eating better. And again, if you have someone who has balance issues or is unable to move by themselves independently very well, try to have someone accompany them whenever they're getting up and moving or walking or doing anything, especially if it's a long distance. Even if they have fatigue-related conditions, like someone with weaker lungs, they might get tired, and if they're tired, they can get lightheaded. If they're lightheaded, they can fall as well. So I encourage you to just have someone accompany them if they have any condition that might make them more susceptible to that. And then again, if you do the exercises, the strength exercises or anything in the form of games where they're working on coordination or balance to prevent the falls, that's going to ultimately help reduce the risk of falls. Okay, this part is a little more specific. This is for patients that have had
حاجة كنت هسألك بعد إذنك على السترينث تريننج. إيه الأكسبتبل سترينث تريننج لناس إحنا بنتكلم في 70 plus؟
I believe usually twice a week should be okay. Twice a week. The principles don't really change when you're going with strength training. You basically just want to gradually increase the load or what they're doing in terms of the volume. So it might be that they're going from, for example, if you look at this picture here, can you see where my mouse is? Can you see my cursor?
Yes, yes.
Okay. So from here, you can see there's not very much load going through the calf. But if you move to the second progression, they're basically standing up, so more of their body weight is going through their calf, so that's working the muscle more. And then the third picture, they're using weights. Basically, you just want to gradually increase that. A simple template to go with is if they do anywhere from 6 to 12 repetitions, 3 sets. Ideally, you would be doing, something for the whole body. But the lower body, I would say, is more important in terms of preventing the risk of falls. But these are some basic exercises that will target some of the important muscles that help with the balance in the lower body. But they should be okay for twice a week. I'll confirm. There are Canadian physical activity guidelines. I think they just changed actually, so that recommendation might be even higher, but at least twice a week for sure. So again, if you have an older individual or a senior citizen, or even anyone who's had a stroke or spinal cord injury, this might be applicable. Basically, whenever you get someone to move, if they're in a wheelchair to a chair, or a bed to a chair, or any two surfaces really, you always want to encourage them to move towards their stronger side. So if they have a weak side, in this picture, for example, the weak side would be on the left. Basically, you're encouraging the person to move towards their right side because they can use those muscles to get themselves to that other surface. And essentially what you're going to do is you want to make sure that the two surfaces are as close to each other as possible. So if they're moving to a wheelchair, for example, move it as close to the bed or chair that they're moving from as possible. Make sure the brakes are on, and make sure the armrest here, make sure that's lifted up. That can usually be lifted up. And what you're going to do is you're going to use your knee here, or your the front of your leg or your shin. You're going to put it against the weaker leg, just to make sure that that is stable as well, because sometimes they have weakness on that leg and they won't be able to hold their weight on that leg. What you're going to do is you're going to bend through your knees, have your arms underneath their shoulders, and then you're basically going to rock back and forth 3 times. 1, 2, 3. And on the third count, you're going to get them to halfway stand up. So as you can see here, the person's not fully standing up. It's just halfway, and then they're pivoting off of their strong leg, which is the right leg in this case, and you're sitting them down. And if you want them to go back to the bed, you're going to have to turn the chair and move the right side of the chair towards the bed. It just depends on whatever side is weaker, stronger. This is very specific, and you're not necessarily going to need to use this for everyone, but in the rare occasion when you do have someone who's had a stroke or spinal cord injury, this is important. We actually had a lot of training on this in school. If you don't feel comfortable doing it, make sure you have someone assisting you so that you're both supporting the person and making sure they don't fall. Okay, so other notes for this population is again, getting them up by supporting their weaker side and not necessarily the strong side. Again, they also might have visual deficits. If they have visual deficits, they're more likely to fall. And keep an eye out for blood clots and changes in the skin, so pressure sores and anything along those lines. They are more common in this population for sure. Okay, so finally, you want to basically be friends with your seniors, encourage them to do fun, challenging activities that's going to help retain their balance and their strength and keep them active. Help them when they need it. Just because we said encourage them to be active doesn't mean leave them helpless if they need help. Make sure they're eating well and consulting with any healthcare providers necessary to make sure that they're healthy and all around, getting their nutrition and medication, everything is needed. And that is all. Any questions?
أي أسئلة يا جماعة؟
ثانك يو ماريو. انا كان عندي سؤال بعد اذنك.
Sure.
زي ما انت عارف الفيزيوثيرابي is not covered by OHIP.
Correct.
عندنا في بعض الناس they cannot afford to do this session. هل في عيادات covered by OHIP?
There are usually عيادات covered by OHIP, but generally the OHIP clinics are reserved for someone who's had a hospital stay overnight or an injury or surgery. I think there might be if you're older than the age of 65 or so, they may have exceptions where you can go to those clinics. The only thing with OHIP clinics is because busy قوي وعشان basically the government is funding it, the government doesn't pay them well, so they tend to have more patients in at a time. ولو في عيانين اكتر في one time period يعني الكير مش هيكون قد كده. طبعا it's probably better than nothing, but I believe it's usually people that have had surgeries or overnight hospital stays or something along those lines. I don't know if anyone can just walk in, but I can double check for you.
ممكن اسالك يا ماريو لو تعرف لو في منطقه اوكفيل وبرلينغتون عيادات can help the low income people بالاوهب، يا ريت تبعت لنا اساميها بحيث ان احنا يبقى عندنا لو حد سالنا نقدر نساعدهم فيه.
Sure, I can do that.
Thank you حبيبي.
Problem.
ثانك يو ماريو. انا متهيألي كده يا جماعه احنا the most common سمعناه النهارده هو keep them moving, keep them active. ان دي ممكن to prevent any complications في حاجات تانية اكبر. فيعني متهيألي دي اكتر حاجه ممكن حتى واحنا بنكلم السينيورز واحنا بنفتقدهم او حاجه ممكن نقول لهم لو يقدروا يتحركوا اكتر، يتقلبوا كل ساعه، يعملوا exercise او حاجه زي كده. انا عندي سؤال يا ماريو. during الكوفيد متهيألي الرول اوف فيزيوثيرابي بقى مهم للناس. طبعا الناس ما تتحركش، فطبعا اكيد بقى في تركيز اكتر على الاكسرسايز في البيت.
Mhm.
فهل الفريكونسي بتزيد ولا انتوا بتقولوا ايه بالظبط بالذات السينيورز يعملوه في ديورنج الفترة الطويلة ان هم قاعدين في البيت ما بيتحركوش؟
I always encourage people to, if they can, walk around their apartment or house or go out for a walk. بالنسبة للexercises, I generally, again, I use the same principles. It doesn't matter what the age is, because you have some people who are, they're age 16, 70 وباسم الصليب, they have great muscle strength and they're very, very active. And you have some people that aren't necessarily. You're going to make sure you're pushing them to challenge themselves, but not to overdo it. And if some people just don't like exercises, so if you have them at least do an activity they enjoy, they're more likely to do it. Even walking, if someone likes to go up or downstairs, I don't like doing that, but you can encourage them to go up or down their stairs. And maybe if it'll be better for them to, if they have other family members, encourage them to take them out with them. Sometimes they just don't enjoy the activity, but if there's a social aspect to it, they might enjoy it more. Those are some of the things that I encourage them to do. Less time in front of the computer. Those are the main things, يعني.
ثانك يو. يا جماعة في حد عنده أسئلة؟
ماجد قال لنا كان المرة اللي فاتت يا سامح لو انت متذكر ان 30-minute walk is recommended every day.
Every day.
Yeah. That's 30-minute activity. وstrength برضو twice a week دي recommended بالنسبة لل how to be active. This is the latest guideline كان ماجد منصور قال لنا المرة اللي فاتت.
Mario, I have a question. I noticed you mentioned that the senior shouldn't sit down for more than 30 minutes, and he got to be moving like every 30 minutes. Is that correct?
Yeah, هو مش لازم يقوم يمشي marathon or like run a marathon or anything like that, but just if they even get up from their chair for 1 minute and sit back down, that's more than enough. Just any movement.
Okay, that leads us to another question, like what will happen for the people who have to, for example, lay on their back on a bed for a certain number of days? Is there any kind of exercise they can do while they can't move out of the bed? Or
So the exercises that I showed you earlier that will help prevent blood clots, you can do those actually while you're lying down in bed. And we're going to go back to them. So
like moving the legs up and down and stuff like that?
yeah, like moving the elbow, if you can see here on the screen. Again, you're just straining and bending the elbow. You don't need to be upright for that. Neck movements might be a little harder, so maybe not that one. Shoulder movements, you can do that, no problem. And the ankle exercises. These are actually fairly common exercises that are given to people in hospitals when they have hospital stays, because when someone's in the hospital for 2 or 3 days, especially if they're older, the amount of weakness that they develop is very, very, very accelerated compared to a younger individual. So even just basic movement exercises are enough to stimulate their muscles because they're not getting any other stimulus. So that would be an option to do.
Okay, thank you, Mario.
Any other questions?
حد يا جماعة عنده أسئلة تانية؟ Okay, thank you, Mario. And I have a question. Can we share the presentations that we sent me to the group?
Sure.
Okay, thanks a lot.
No problem.
شكرا يا ماريو. يعني كلنا استفدنا معلومات مهمة جدا، وبالذات ان احنا بنتحرك كل دقيقة، وان احنا كل ساعة لازم بنعمل اكسرسايز او بنتحرك من مكاننا او نقوم او نقعد حاجة زي كده. بالتالي دي هتفيدنا كتير قوي ان احنا بنتكلم مع السينيورز لو هم ما عندهمش موانع تمنعهم من الحركة، ان احنا نقول لهم اتحركوا كل فترة صغيرة. Thank you Mario for coming. وسامح اتفضل بقى لو عندك اي تعليمات.
شكرا سامح. شكرا يا ماريو. محاضرة جميلة، ويعني إن شاء الله نبقى مرة تانية نستعين بخبرتك وتيجي برضو ممكن تعمل شوية exercise you can recommend it للسينيور. وثانك يا حبيبي، ربنا يوفقك. بشكرك سامح على بشجع بس الناس اللي ما عملوش الامتحان الأسئلة انهم يراجعوا الفيديوهات ويراجعوا الأسئلة، وعشان ما تتكومش علينا. احنا كده نكون خلصنا سامح الموديول ولا لسه عندنا حاجة تانية؟
لسه عندنا الاسبوع الجاي اخر جزء من الموديول. لسه بقى يعني ربنا يسهل في البلاننج يعني.